Christy, thank you. Well, we've talked a lot about this opioid epidemic. It is a serious problem, but one thing you may not have heard about so far is what some are calling the other opioid crisis.
It has to do with how coroners and medical examiners conduct investigations and report the cause of death. 7 News anchor and reporter Diane Lee talked to local coroners. She joins us now. Diane.
Well, Amy and Gordon, a new study finds that opioid-related deaths are likely vastly underreported to the federal government because not all coroners list the exact drug or combination of drugs. And in South Carolina, there is no state standard requiring those specifics.
42,000 opioid overdoses. The latest Centers for Disease Control numbers may seem like a lot in 1 year, but according to new research out of the University of Virginia, that number is likely 20 to 35% higher.
What the opioid epidemic has shown is how weak and thin our death investigation system is.
Sam Quinones, the author of Dreamland, the true tale of America's opioid epidemic, is giving talks across the upstate today and tomorrow about what he's uncovered.
There was no bridge to heroin until OxyContin.
One of his many concerns, the lack of detail on death certificates, which leads to underreporting. Spartanburg County Coroner Rusty Clevenger says this past year his office has been working with the state to make sure drugs listed on death certificates are coded in a way that gets accurately reported to the federal government.
First concern was, let's get it straightened out. Let's make sure we've got something going on that, you know, we'll get them reporting it correctly.
On the local level, accurate reporting helps show the extent of the problem. For instance, in Spartanburg County alone, opioid overdoses have more than tripled in the last 4 years, and fentanyl has jumped from 4 cases in 2014 to 20 last year.
That's why Clevenger aims to list specific drugs on death certificates. But other offices like Greenville say right now, if a mixture of drugs is to blame, that certificate won't list them all.
If you don't have that information, you don't know something is happening when you should know it, and it's not been fully funded, and that's largely because nobody thinks coroners' offices are sexy enough to fund.
Yeah, so the bottom line here is better reporting can lead to more funding for programs that help curb the problem. And that's one of the many things that the author is going to be speaking about tonight at the Chapman Cultural Center, free to the public, by the way, and also tomorrow in Greenville. And I'm going to post those times and locations at WSPA.com.
How can we trust any of these overdose numbers? If Spartanburg and Greenville are logging these differently, how do we know what the baseline is?
The push is to have a more uniform logging system. It's not necessarily that it's inaccurate at the local level. It's just, how do those numbers get to the federal level? They go through the state and then to the federal government. And sometimes in that process, either, as in Spartanburg County, they have to reconfigure the coding of it to make sure it's accurate. Okay. Or as in Greenville County, you might want to revisit the whole idea of when a number of drugs are responsible for a single death, should you then list all of those drugs to help that reporting system be more accurate? Again, because more accurate reporting can lead to help for this problem.
Yeah, it needs to be one standardized system, or as it really doesn't mean
Perhaps
anything.
that's the push.
All right, Diane, thank you.